Welcome to yet another exciting episode of MEDIGO Round, and I'm Pachino, and as always, we would look into a lot of concern, facts, and things that are interesting from a medical point of view. On this episode, we're going to look into how a healthy diet plays a vital role in the life of people living with HIV and AIDS. People living with HIV are living longer and a healthier life, thanks to antiretroviral therapy, which suppresses the virus. A balanced diet is very important in maintaining all aspects of a good health and a strong immune system. Together, antiretrovirals and a good nutrition partners in helping people feel better and manage their diseases. People living with HIV are more likely to develop high cholesterol, diabetes, and osteoporosis, partly as a side effect of some of the antiretroviral medicines. As well as playing a role in helping the immune system function better, good nutrition can keep the gut to enhance absorption of nutrients and drugs, and it can also help treat and prevent high cholesterol and body fat changes. Together, a balanced diet, activity, and exercise can help maintain an ideal weight and reduce the risk for developing diseases such as diabetes and osteoporosis. Research has shown that regular assessment and advice from a dietitian prevents development of HIV-related high cholesterol. Specialist dietitians provide medical nutrition therapy and specialist individually tailored advice to help support people living with HIV to eat well and be healthy. In the past few episodes, we did discuss about obesity and other health concerns related to women. On this topic, I'm going to bring them closer: obesity and women. New researchers have found that the obesity status of women can decide the rate of breast cancer cell growth and the tumor size. This study is published in the journal Breast Cancer Research. Obesity is considered to be a major risk factor for breast cancer in postmenopausal women, says researchers from the Tulane School of Medicine in New Orleans. According to a previous study published in JAMA of more than 80,000 registered nurses, women who gained 55 pounds or more after the age of 18 were found to have a 50% increased risk of developing breast cancer. The research team analyzed a series of fat stem cell lines that had been taken from 24 women who were undergoing elective liposuction. Researchers say that a woman's obesity status, particularly fat in the abdomen area, may determine the rate of breast cancer cell growth and tumor size. On examining the tumor growth from the samples, the researchers found that the cells taken from women who were obese increased cancer cell numbers and tumor growth, and this detection was most significant in cell lines taken from abdominal fat. The researchers say that this finding may be due to the exposure of the fat cells to estrogen. They say that this boosts the production of a hormone called leptin. Now that we had an insight into the research data, it is very evident that obesity is linked to cancer cells. So the best way to do and to keep away from cancer is to stay fit and stay healthy. Now let's take a mini tour of our brain. Brain region key to decision making has been discovered. Isn't that fascinating? The function of lower habenula, one of the smallest brain regions, and evolution-wise considered the oldest, has been somewhat of a mystery to science, although there is evidence that it is involved in depression and avoidance nature. Now let's take a mini tour of our brain. Brain region key to decision making has been identified and discovered. Isn't that interesting? It's definitely interesting. The function of the lower habenula, one of the smallest region of brain, and evolution-wise considered one of the oldest, has been somewhat of a mystery to science. But there is evidence that it is involved in depression and avoidance behavior. Moving on to the next topic, we're going to take a peek into how geographical differences are found in causes of blindness worldwide. The investigators looked specifically at cataract, glaucoma, macular degeneration, diabetic retinopathy, trachoma, and uncorrected refractive error, and estimated how these conditions contributed to visual impairments in proportion to age, geographical region, and year. Significant geographical differences discovered were that the results of the analysis revealed that the overall number of people who suffered blindness as a result of cataract reduced from 12.3 million in 1990 to 10.8 million in 2010. Moderate and severe vision impairment as a result of cataract decreased from 44 million in 1990 to 35.2 million in 2010. A new study has revealed that the proportion of vision impairment and blindness worldwide that is caused due to cataract and macular degeneration varies geographically. While we were going through the visuals, I took a moment to close my eyes and tried walking around. Trust me, you can do the same and see how important your sight is. Take care of your eyes because being blind is a very tough situation. So while we were watching these visuals, I took a moment to close my eyes and walk around the studio over here. Trust me, it's difficult. Let's do this. Let's close our eyes for 10 seconds. And that's how the world is for a blind person. The way I'm doing right now, all I can see is only darkness and sometimes some colors of red, and I can see a yellow around. But for a blind person, it's all black. Take care of your eyes. Take care of your eyesight. It's too precious. With this wonderful message, we come to an end of this wonderful episode of MEDIGO Round. Thank you so much for watching, and this is Pachino signing off. Have a wonderful day.